YouTube, Nick Pratap here from Next Gen Rehabilitation, clinical exercise physiologist. And today I'm going to be showing you a workout for individuals that are either elderly or individuals currently living with a certain chronic disease such as metabolic disease, diabetes, cardiovascular issues, COPD. That's nice and basic that you can do at home. All you're going to need is some weights. If you don't have dumbbells, you can use some water bottles. You can use soup cans, anything that range between 1 to 5 pounds. Now, if you don't have any weights, you can also perform the same exercises without weights, just using the same motion that I'm going to be showing you today. Now, as with any exercise program, please make sure to talk and consult with your doctor before getting started, just to make sure that you're able to perform exercises without necessarily having to be monitored by either an exercise physiologist or a kinesiologist. And now, to get started with the program, the first thing that I want you to do is do some kind of warm-up. Okay, so the reason for the warm-up is to get the muscles going. So we don't think about it as a car. You don't want to just get in a car and start driving. You want to make sure that the car gets warm, it's idled for about 5 minutes, and then it's able to go out. Same thing with the body. You want to warm the muscles up, you want to get the joints lubricated, and then you want to start the exercise. Especially for someone that is living with a chronic disease, it does take a little bit more time to get the body going. So for warm-up, what I'd recommend is going for a nice easy walk, maybe around the house, maybe around the block. Nice easy pace. You can easily talk, you can easily have a breath. You can maybe go on a treadmill or a bike if you're at home, a stationary bike if you have one of those. And then after going for that 10 to 15 minute walk, you're going to come back and you're going to go ahead and grab your set of weights. Alright, so I'm going to use a couple soup cans today. So this workout is going to be primarily for the upper body. On the next video that I'm going to be making, it's going to be for the lower body. Now throughout these exercises, I'm going to give you different variations if you do feel certain pain in any of the motions. So feel free to adapt as we go along. Alright, so let's get started off. The first exercise we're going to do is known as the bicep curl. We're going to rotate the wrists so the palms are pointed forward. Our feet are situated a little bit wider than hip width apart. Shoulders stay locked. I'm going to curl the arms up. I'm going to lower down. So notice as I'm curling, my shoulders stay locked as I bring those weights up to my shoulder and then slowly lower them back down to my thighs. Okay, it's a 2-second motion, 2-second count. 2 seconds up, 2 seconds down. Breathing out as I come up, breathing in as I lower. Okay, notice I'm not swinging my arms. Okay, keeping my low back neutral so I'm not excessively arching it. And we're going to go for about 12 repetitions here. Now if you do feel like you are swinging or losing some stability, feel free to either A, do this exercise sitting, or B, doing this exercise up against a wall with your back flat up against that wall. And 1. Nice. Good. The reason I like standing and doing these exercises is because it engages not only your core but the rest of the musculature of the body. So it forces your body to balance itself out while using some set of weights. But if you do have any issues with the legs, feel free to grab a seat. Now between each exercise, I want you to make sure that you're moving your feet side to side. Okay, and the reason for this is to pump the blood from the legs back up to the heart so it can recycle and go back to the muscles where it's needed. Now if we don't move our legs, we run the risk of the blood pooling, and if you're a heart patient, that can lead to blood clotting, which is something that we don't want happening because those blood clots can go to certain parts of the body and lead to an episode happening. Now, the second exercise we're going to do is what's known as the shoulder shrug. Palms stay fixed facing the body, and all we're going to do is elevate the shoulders, depress the shoulders. Okay, so again, your feet are situated a little bit wider than hip width apart, slight bend in the knees, you don't want them fully locked out. And all we're doing is bring our shoulders up to our ears, lowering down. Breathing out, breathing in. Breathe out, breathe in. Good. Up, down, up, down. Halfway. 1. Good. Breathing out, breathing in. 2, 3, 4, 5, and 6. Nice work. Alright. So, again, keep the feet going side to side. Couple seconds in between each motion just so you can get that blood back to the heart. Next exercise we're going to do is going to be for our core muscles, alright, our obliques. Keeping the weights locked into the side of the body. Okay, all we're going to do is tilt to our right, extend back up. Okay, tilt to our right, extend back up. We're breathing in as we lower, bringing out as we come up. So notice my right arm. Okay, there's no movement in the arm. All the motion is coming from this oblique, the side of the body. Okay, so we're working on strengthening one of the core muscles known as the obliques here. And all we're doing is bending to our side and extending up. Now if you're getting any pain, you're bending to that point right before the pain's felt, extending up. 2, good, and 1, nice. Alright, we're going to do the same thing on the left side. Bend over, extend. Again, if you get pain right here, come to there, extend up. Come to there, extend up. Good. Breathing in to be lower, breathe up. Breathe in, breathe out. Good. Down, up. Down, up. 4, 3, 2, and 1. Nice job. All right. So keep those feet going side to side for a couple seconds. Get that blood back to the heart. Good. All right. So for the next exercise, you're going to go ahead and set one weight down. You're going to grab the weight. One hand grabs the bottom end of the weight or the bottle. Other end grab the top end. Okay. Slight bend in the knees with the hips back. We're going to bring that weight nice and close to the chest, and we're going to push it straight out. Okay. Bring it in. Push it out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Good. In. Out. In. Out. So we're working a little bit of the triceps here with that extension at the elbow. Okay. We're working a little bit of the chest here. That horizontal flexion, bringing that arm across the body. 3. Good. 2. Perfect. And 1. Nice. All right. Good job. Again, keep those feet going side to side. Now for the next exercise, we're going to do what's known as a Woodchopper or an oblique twist. So you're going to interlock your fingers around that weight, soup can or water bottle. You're going to start up at your right shoulder and you're going to rotate to your left hip. Yeah. Right shoulder, rotate, left hip. So take it nice and controlled. 2 seconds up, 2 seconds down. Breathe in, breathe out. So notice the weight's now way out here. I'm keeping it nice and close to the body, and I'm just turning. Okay, no movement in the arms. All the rotation is coming through, again, my torso, those oblique muscles. 3, 2, and 1. Good. We're going to go the other way. So we're going left shoulder, rotate, right hip. Left shoulder, right hip. Breathe in, breathe out. Okay, again, same thing. If you're getting any pain with this exercise, or if you feel like your legs are fatiguing, go ahead and either A, grab a seat, and if you are getting pain, you're just rotating to that point right before you feel the pain, and then resetting to the beginning of the exercise. 2, and 1. Good work. Now, for the next exercise, you're going to go ahead and grab a chair. If you need to pause the video, go grab a chair and then come back and start it again. I got a chair handy here. So, first part, you're going to start with your right leg in front, left leg behind. You're in a bit of a split stance. Okay, you're going to put your right hand on the chair, left arm. It's nice and close to the side of the body. We're going to do what's known as a one-arm row. You lean forward slightly. Okay, shoulders are down and back. Think about taking your shoulder blades, tucking them into your back pocket. You want to keep them there for this entire exercise. You want to pull straight up, breathe out, breathe in as you lower. Okay, almost like starting a lawnmower. Pull up, lower the arm down. Pinch the shoulder blade back, lower down. Okay, breathe out, breathe in. So there's no need to bring it way up here. Elbow just passes the side of the body, and then you lower back down. Just passes, lower down. Good. 3, perfect. 2, and 1. Good. We're going to switch. Okay, so now your left hand is holding the chair. Left leg in front, right leg behind, split stance. Lean forward slightly. Okay. You want to slightly squeeze your glutes to the bum muscles, just to provide a little bit of support for that low back. Pull up, lower down. Okay, so same exercise, just like starting a lawnmower. We're breathing out as we pull up, breathing in as we lower. Good. 4, 3, 2, and 1. Nice job. All right. We're going to take that weight. We're going to put it back into the left hand. We're going to go back to having the right hand in front. Okay, right leg is in front, left leg behind, split stance. We're lean forward slightly. We're going to lock our elbow, side of the body. Okay, we're going to go into our tricep extension. Extend the arms straight back, lower down. Breathe out, breathe in. Breathe out, breathe in. Good. Out, in. So notice my shoulder. There's no movement. I'm only extending out my elbow. We're working the back of the arm here, the tricep muscles. 4. Good. 3. Good. 2. And 1. Switch. Okay. Left leg in front, right leg behind. Left hand is on the chair. Elbow stays locked to the side of the body. Extend the arm. Bend the arm. Breathe out. Breathe in. Good. And slight squeeze in the bum muscles, the glutes, to provide that low back support. 5, 6, good. 7, 8, 2 more, 9, and 10. All right, good work. So we're going to go ahead and set the weights down. Okay, you're going to keep the legs going side to side. We're going to finish off with a little bit of a stretch here. So you can go ahead and set your chair off to the side. Now it's very important after finishing any type of resistance training or any type of workout that you perform some type of stretch. Okay, your muscles are warm. You're more prone to being lengthened at that point. Now, if you try stretching a muscle when it's cold, you run the risk of injury, just like if you try exercising when your muscles are cold. So that's why we want to have an adequate warm-up before the exercise and a proper cool-down to bring that heart rate down gradually and stretch the muscles up, especially with someone who's elderly. Joints run into issues, especially the wear and tear you take over the years. So it's very important not only to strengthen muscles, but also to stretch the muscles out to help keep the integrity of the joints and the flexibility all throughout the body. So we're going to go right arm across the body, left arm tucks in under the elbow, okay? And with this left arm, you're just going to pull in towards the body. Now, some people aren't able to do that and doing something like this, just bringing it across, that's okay too. So you take it to the point where you feel comfortable. Again, keeping those feet going side to side, breathing in, breathing out. Shake it out, switch arms, left arm across, right arm tucks in underneath. So again, arm across, right arm under the elbow. Same stretch, opposite side. 4, 3, breathe in, and breathe out. Good job. Shake it out, roll the shoulders up and back. 1, 2, 3, 4, 5, 6, up and forward. 2, 3, 4, 5, and 6. Good. Shaking it out. We're going to interlock our fingers, pull the shoulders forward, separate our shoulder blades. So we're just stretching out our rhomboids. Okay, those muscles of the back, the mid-back. Should be feeling this right in between our shoulder blades here. Okay, holding the stretch. 4, 3, 2, 1. Shake it out. Left arm comes straight up in the air. You're going to set your feet shoulder width apart. You're going to lean over to your right. Okay, again, if it's too challenging to do the standing up, you can always do it sitting in a chair. 2, 1. Back to center. Right arm comes straight up. Reach. Really elongate that oblique. Lean over to your left. Now, for the purposes of this video, I am doing these stretches a little bit faster than I should be. So if you are performing these stretches at home, I'd recommend holding them for a minimum of 30 seconds, all right? And when you are performing these stretches, make sure you don't hold your breath. You want to make sure you have a nice controlled breathing tempo. Good. Shake it out. Stomp the feet. 3 deep breaths in through the nose, and breathe out. One more time. Breathe in and out. Last one. Breathe in and breathe out. All right, great work today, everyone. Thank you for joining me on this channel. There is going to be a lot more content coming out for specifically, again, individuals that are elderly, individuals living with chronic disease, specifically cardiovascular disease, diabetes, metabolic disease, COPD. So if you are interested, if you do have any questions, feel free to write them down in the comment section. Share this video if you know someone that would benefit from something like this. And throughout the weeks, I will be putting out more videos, some leg exercises, some more advanced routines, and just let me know what you want to see. Okay, I work as a kinesiologist as well. I work as a clinical exercise physiologist in the hospital, so I have been around this population. So if you want to see certain stretches, certain workouts, certain exercises for rehab, feel free to leave a message, and I'll do my best in answering all your questions. Have a great day. Take care.